we're here at Himss 2012 in Las Vegas with CCI Tec, Devon, Cochenour, and Charles Owen. Devon, let's start with you. Why don't you tell us a little bit about who CCI Tec is and what do you do in the healthcare space?
CCI Tec is a company, and we are a Microsoft partner. We provide innovation through integration. What we specialize in is integrating healthcare environments to be able to share data and use that data through analytics and be more intelligent about how those healthcare companies are able to access that information through SharePoint, SQL, BizTalk, and beyond.
And you work with both health plans and providers. I know I've had you working at Blue Cross Blue Shield of Louisiana and some other accounts, correct?
That's correct. We've worked from every angle of healthcare. We've worked from providers, payers, state agencies, which are hybrids, to clearinghouses, to just about every aspect of healthcare, both from HIPAA, HL7, we can say all the acronyms.
That's great. And Charles, we're going to move over to you.
Sure.
Cloud technology has become a huge topic in every industry, but in healthcare it's going to be extremely relevant because of the cost savings and the potential opportunities. What are you guys seeing from your customers around cloud? What are you hearing? And what have you done to get yourselves ready to move into the cloud?
Yeah, I think it's a well-proven fact that cloud technology is going to bring some tremendous efficiencies and savings in healthcare. And we actually developed a wellness portal for Blue Cross Blue Shield of Louisiana along with another Microsoft partner. And the wellness portal actually provides providers and plan members as well as physicians a self-directed site to enable them to get access to the information that they need. And the next logical step would be taking that to the cloud, and we hope to do that one day.
Exactly, easily expanding those portals and those wellness programs through the cloud, scaling it to new populations, and reaching across devices, which takes us to our next question, Devon, mobility. Mobility, again, touching all industries, but in healthcare can be extremely significant when we talk about patient engagement, member engagement, and the consumerization of IT. What are you guys seeing about mobility, and how are you preparing to support Microsoft's mobility efforts?
Well, the biggest thing for us and what we're looking at going down the road is both from the aspect of how it enables people to access their information quickly, easy, and from any location. From both the aspect of the patient who has information, questions, lab results, whatever that may be, to doctors needing information, being able to be out and about and still be able to access patient information and integrate those things into their daily lives to make patient outcomes better. The biggest issue around that is compliance, and HIPAA compliance specifically, security and what information gets out there and how we do that. That's where we focus. We've been a HIPAA provider for doing integration work for a very long time, and that's one of our expertises. So what we're looking at is how we take, for example, the wellness portals and map those over into using SharePoint and other technologies for mobile devices.
And that's an extremely important point. I agree. The compliance requirements, working with partners who understand what HIPAA requires from security, technical safeguards, physical and administrative safeguards around security is extremely important. So that's what our healthcare partners have to bring, and I do know you guys bring it to our clients. It is a big differentiator for us, and we need to keep using that. Charles, the next question is for you. We're seeing health information exchanges, health insurance exchanges. Everybody's talking about accountable care organizations. What are you guys hearing from your health plans and your provider customers, and where are you going? How are you starting to support those efforts?
Well, this is a cool thing. This is what we do. I mean, we bring commonality to the IT chaos by merging disparate data into a common infrastructure so that these healthcare organizations can get access to this information and make more intelligent decisions. Accountable care and information exchange really begins with application integration, quite frankly, and that's precisely what we do. So we're very excited about.
Right, I mean, I agree. It's about making the data connections, getting the data to the right places at the right time so that it can drive accountable care models, health insurance exchanges, and health information exchanges. Great point. And it takes us to an exciting announcement for you guys here at Himss 2012 around the Tech Enterprise, Claims Enterprise. system that you just announced off of work that you've been doing at Blue Cross Blue Shield, Louisiana.
Yep.
So I want you to describe that. It's all about business intelligence, a little bit about data warehousing, and a data model that is specific to the industry. So tell us what you can. I know you've got some announcements and some collateral that we can get off of your website. Just let the audience know how they can do that and what you guys have announced.
Absolutely. Well, our website is ccitec.com, and actually you can get information about our new Tech Enterprise Claims solution off of the website. There's a full data sheet on there, and what Tech Enterprise Claims is it addresses the issues and the problems that the various stakeholders are having with claims. For example, executives, EDI managers, claims managers, people that need access to the claims wherever it is in the life cycle of that claim. And it's very important that they can have this information and be presented with key performance indicators depending on who they are logging in, and be able to see the information that's important and relevant to them. So it takes information from all these back-end systems and serves it up and follows. What we do is we provide the SQL database to follow that information and be able to pluck it out in dynamic, in a dynamic mode in real time, and serve that up to the relevant stakeholders.
And surface it through SharePoint, through Office components.
Absolutely.
Make it available across devices.
Yep.
One of the things that I do want the audience to understand, it's based on SQL Server, BizTalk.
Yep.
It uses SharePoint, so it's a great way to really emphasize the additional capabilities of those products. But also the other thing is, it leverages the Edifex installs around HIPAA 5010 solutions. So anyone who has a customer using Edifex is a great candidate for this solution, right?
Oh, absolutely.
Okay, that's great. Moving on to a couple of other things in industry trends. It's all about chronic condition management, disease management, driving wellness in an organization. What are you guys seeing, and what are you doing? What types of services and solutions or projects are you getting involved in to help those organizations in those types of programs?
One of the things that we do is really elevating that information so people have it at their hands when they need it. So what we've done with the Tech Enterprise Solutions and what we've done in the past as far as is enabling BI through SQL, SSRS, SharePoint to be able to elevate those things so that we can track and manage those things that cost the healthcare companies the most amount of money. So looking at things like what are the most 25 ICD-9 codes, ICD-10 codes, those things that have a diagnosis, and being able to track those and elevate those so I can start planning how those certain types of KPIs are going to affect our business. So being able to look at that and plan it, and then also look at it from not just the patient aspect, but also contract management, looking at it as far as supplementing my information to my executives to be able to look at that and make intelligent business decisions. That's what we do.
So I'm going to throw in a little bit of an extra question, because I know in the field we hear a lot about HIPAA 5010, ICD-9 to ICD-10, medical loss ratio. You're using those terms, and Microsoft field teams need partners who understand what those are. Is that a differentiator for you guys?
I think it really is. We've been doing healthcare integration work and healthcare networking for the last, for me, 15 years. We have a very experienced team. We focus almost exclusively on the healthcare industry. We know all the acronyms, we know the compliancy issues, we know the security regulations. We've done this forever, and that's where that is our sweet spot. We know this. We can speak to the executives who want to know and understand that we can feel their pain and address it.
So that's great. Again, it's about the industry. It's about the industry solutions, not just the products. Okay, and as we wrap up here, I know I'm going to ask the last question, but just talk to me about providers and what you're seeing providers do with BizTalk. What's the opportunity for SQL Server, BizTalk, the core servers and tool products in the provider market?
Well, the whole thing from the provider's perspective is being able to figure out how to get claims paid quickly. So what we do is we enable providers to scrub their data, look at their data, analyze their data using SQL, BI, looking at the information before it goes out the door to estimate, figure out, and basically preempt any issues that may cause a claim to not be paid. Bringing that window, that claim window down to where it's a much shorter thing, so we can get that stuff addressed before it goes out the door.
Right, so reducing the revenue cycle time,
Right.
reducing the claims that are pending or unpaid. These are important issues for providers, for a chief financial officer and a provider. They want to get paid accurately, they want to get paid quickly. So that's it today with CCI Tec. Guys, I really want to thank you. Again, a real go-to partner for Microsoft in healthcare with BizTalk integration. Again, they mentioned HIPAA, ICD-9, ICD-10. Key terms to look out for in your accounts. So thanks, guys.
Thank you.
Thank you, Hector.